step. Momentarily, you will be hearing from local leadership information pertaining to the COVID-19 outbreak. But before we join them, I would like to let you know that today's broadcast will be aired again here on WSOT TV at 5:30 p.m. and again at 10:30 p.m. this evening. And additionally, on Sunday, May the 10th, that's Mother's Day, Happy Mother's Day, at 10 a.m. and again at 5:30 p.m. Now, today we are going to be joined by phone by Bob Jackson of the Grant County EMA, and I would like to welcome Bob Jackson now. Bob, are you with us?
Thank you, Angela.
Thank you for joining us.
Just a quick note from Grant County Emergency Management and all of our first responders in the county. We would like to wish the nurses a happy National Nurse Appreciation Day and for all that they've done for us, particularly through this time period. So on behalf of all of us, thank you. Additionally, from the Grant County Emergency Operations Center, we are looking at shifting gears a little bit more from a response to recovery as we move forward now that the governor has given us a roadmap to try to reopen the county and the state. So we're shifting gears a little bit. However, we are always at the ready for a response, and we will continue to do that when needed. We're still a little short on PPE, and we expect that to continue for some time. We will work through the summer to rebuild our inventory and really to try to build a stockpile so that in the event that we get a resurge at some point, whether it's in the fall or wherever, that we would be better prepared than we have been. So continuing to work on those fronts. Our emergency response agencies are coming together, and we will maintain a core group, even though we're switching to a more recovery mode in the Emergency Operations Center and probably won't meet daily. We stay in contact all the time, so if something does happen, we can quickly reconvene and bring those decision makers, all of our department heads, chiefs, and those kind of folks together. We can assemble pretty quickly if we have to. So we will remain at the ready there and continue to be prepared, and we will keep you updated as we go. But like everyone else, we're looking forward to recovery and reopening. I believe that is all I have for this week. Thank you.
Thank you so much, Bob Jackson, Grant County EMA. Keep up the good work. Now joining us here in studio will be Grant County Commissioner Mark Bardsley. Welcome.
Thank you, Angela. And thanks to all of our media partners who continue to get out this information and updates to you in a timely manner. We appreciate it very much. Thanks to you, our Grant County residents, for making positive decisions in this effort to curve and flatten the curve on this pandemic. I want you to know that our stay-at-home policy that the governor has issued over the last weeks has been working. And as we just look at plain old common sense, it tells us that the less interaction, the less exposure. The less exposure, the less contamination. The less contamination, the less infections. And we have positively been working through this over the last few weeks. And again, thank you for your help and support in doing this. I was listening to a doctor who had worked for the Center for Disease Control this past weekend, and he had indicated that really what we have done is we have interrupted this virus. We have been able to just kind of stall it for a little bit in that it's not being spread through the communities like it could have been, and so we need to be prepared for what our day-to-day operations will be in the future. And in fact, we've bought some time, and some of our daily procedures have been changing. This past weekend, I also went to Lowe's, and I had to go through the gate, and I had to wait my turn to get into the store. And it only took an additional 10 minutes for me to actually go through the gate, wait my turn. And so we want to encourage folks, as these processes are going on, please be patient. We will get through these inconveniences, whether it's at the store or at the the supermarket, the retail shopping centers, realize that we have protocols that we're going to be following in order to keep this curve flat as much as possible. I do believe that we're moving in the right direction, and we can celebrate the fact that some who have tested positive in past weeks now have gone through their isolation and through their treatment, and they're responding and now are testing negative toward this infection. Grant County has and will continue to test first responders, making sure that they're doing fine. And the state of Indiana will be setting up a test location in Grant County, and Dr. Moore will be sharing more information on that here in just a little bit. But I do want to remind you, as testing continues, please be aware that the positive tests will increase. But again, the more we test, the more we know. And the more that we are aware of these infections, we can isolate, we can treat patients, and protect our community at the same time. And so we want to continue to encourage that physical distancing, all of the hygiene things that we need to do, wash our hands, and those masks that are going to become part of our society here for a while. Right now we are in stage 2 of the governor's projection on how to get us back to our normal, and just wanted to talk to you a bit about stage 2, the first part of May, and stage 3, the second part of May, and just remind you of some things. Social gatherings are permissible in 25 or less, and again, that's with the social distancing, the physical distancing involved. Travel restrictions have been released, but again, I ask you to use caution. We're still trying to keep a separation, and there are a lot of folks that haven't driven for 5, 6, 7 weeks, and so some of us need to remember how to drive as we're out there. So please be safe as you go to and from. Starting next week, May 11th, personal services are going to be starting back up. Hair salons, barbershop, nails, spas, those type of things that are again, service provided. And I've already set up my stylist appointment for about a week and a half from now. And I was reminded, make sure you wear your mask or I can't serve you. So please be aware of that. It's exciting that the restaurants and bars that are serving food now can move next week to a 50% capacity of those in the store, and we're excited about that. The state is also opening BMVs and other departments for service to the community, so be aware of that. One item for religious services, they may resume as of May 8th, but again with social distancing and special recommendations. And anyone that has questions about that, I'd encourage you to go to backontrack.in.gov, and there's a button there for places of worship that will tell you what some of those qualifications are. Make sure that you check that out if you haven't yet. And again, to our most vulnerable population, those who are 65 and older, those who have special physical needs and health conditions, we want you to remain at home as much as possible, still sheltering in place, staying at home and taking care of yourselves. Toward the end of the month then, stage 3, about May 24th, will kick in. Now I do want to prompt you that remember, this is a fluid situation, and there's a possibility we may see large groups of clusters where other infections pop up, and so that may be sooner, it could be even later, but be aware of that. By that time, we're hoping to see social gatherings of up to 100 people, and that is with no travel restrictions, of course. Retail stores will be moving to a 75% capacity. That's exciting. Gyms and fitness centers to be opening up probably by the end of the month, as well as recreation, pools, campgrounds opening up so that the Memorial Day weekend and as we move toward the summer and holidays, we're moving back to normal. When we started just a few weeks ago, 7 weeks ago now, we said this was a marathon. It wasn't a sprint. And I want to encourage you to realize that we still have some way to go. Don't give up. Hang in there. I'm reminded in 1 Chronicles chapter 16, verse 4, give thanks to the Lord, for he is good. His love endures forever. And most certainly, he has been encouraging and helping us along. The New Testament also says in Colossians, and whatever you do, whether in word or deed, do it all in the name of the Lord Jesus, giving thanks to God, the Father, through him. I am thankful for God's mercy. I'm thankful for what our community has been spared, even though we've gone through infection and we've lost loved ones. But with your efforts and God's grace, we are seeing success in this particular wave of the pandemic, and I thank you for your support. So be steady, be strong, be safe. Thank you.
Thank you, Commissioner Bardsley. And next we will be joined by Mayor Jess Allenball of the City of Marion. Welcome, Mayor.
Thank you, Angela. Appreciate that. Some updates for the city. We did start picking up yard waste again, started that a couple of weeks ago. Hopefully when you see our employees out picking up yard waste, you don't get too close to them. Remember social distancing. We're asking our employees to put their mask on when they exit the truck. We're sending them out solo. Instead of riding two in a truck, we're now going out one person per truck just because of this coronavirus. So please, when you see them, you can talk to them, but keep your distance. The other thing we're doing is the transportation department is still running the buses. We're continuing to run them only by appointment. We prefer you give us a 24-hour notice. We're taking you to the grocery, to the doctor, to the pharmacy, just the essential travel that you need. We're not taking you across town to visit your friends. So make sure that you have a real need. Call the transportation department. They will get you taken care of. We're limiting the number of people on the bus. Again, due to the virus, we're trying to limit the number of people so we can practice 6-foot social distancing on the buses too. And we're currently in the process of adding some plexiglass around each of our bus drivers, and that's a work in progress. We're doing that to the buses. Again, this is probably going to go on for some time, and it could be our new normal as we look forward to our future now. But new normal is not a term I like to use, but we're not going back to the way things used to be, so we're going to have to figure this out. It's a journey we're all learning together. One of the things we're trying to decide on is what we do with the splash house. The children have gone through a really difficult time. It's tough on all of us, adults and children alike, but particularly our school-age children. Our seniors lost their graduation, their proms. If we can get the splash house open and safely, and we'll probably do that, if we open up, it will be done with a much smaller gathering. We'll probably do 1,200 people capacity. We'll shoot for around 500 or 600 people and manage the number of people. If we open, and that's something I'm discussing with Dr. Moore, was discussing it with him even before I spoke here just now, and trying to figure that out, because if we can give the children some fun at the splash house before they hopefully go back to school this fall, instead of doing the virtual classroom that they're doing now, hopefully we'll get that splash house open. They can have some fun out in the sun, and that's, again, a work in progress, not a decision I've made yet. Another thing we're working on is getting PPE for all of our city employees so that we can bring our city employees back to work. Citywide maintenance in the parks have primarily all been working. That's outside work. They can keep their distance. City Hall, we've had a very sparse staff for some time now, for about 2 months. We're hoping to get that back to more normal. Again, only essential personnel needs to be there, but most of City Hall is essential personnel. There's a couple of people that will be allowed to work from home. What we need, though, is that PPE equipment. We've ordered masks like this that I now wear when I'm out in public, and also we are getting those thermometers that check your fever. We can swipe each person every day, each employee, and once we have those, we were opening up City Hall for the employees only, not to the public yet. We hope to have those in today or tomorrow. If not, we won't open next Monday, but probably the following Monday. So if we can't open on May 11th, we will try to get our employees back in City Hall on May 18th. It will remain closed to the public. So I want to encourage everyone. I shaved for you today. It's the first time I've shaved in almost 2 weeks, and I'm tired of not having my hair cut. I look forward to the day when we can all get back to our more routine way of living. But until then, keep practicing your social distancing and look to help those in your community, in your neighborhood, that may need extra help and attention at this time. Look out particularly for the elderly. Keep us in your prayers every Monday morning at 7:30. We're not doing the prayer in City Hall at this time, but you're welcome to join me at 7:30 every Monday. I will be praying for my home, and we'll beat this virus together, and we'll come out of this a stronger and better community. Thank you.
Thank you, Mayor Allenball. And next we will be joined by Sarah Evans from Marion General Hospital. Welcome.
Thank you. I'm Sarah Evans, representing Marion General Hospital, and we just want to share that we continue to be testing people who are experiencing COVID-19 symptoms consistent with the CDC and ISDH recommendations. We're very happy that on Monday, May 4th, we were able to resume some of our elective surgeries, and while we understand that having an elective surgery during this time may seem to be a scary thing, we just want to assure you that it really is a decision that should be made between you as a patient and your healthcare provider, and a discussion of the risks and benefits to proceed with an elective surgery. We are taking all CDC recommended actions to provide the safest surgical experience possible for our patients. There continue to be visitation restrictions at the main campus as well as limited services at our outpatient clinics. And if you have a scheduled outpatient visit, the things that you're going to see a little bit different is that we're going to ask you to wait in your vehicle until close to the time of your appointment, really to reduce the number of people congregating in our waiting rooms. You will receive a phone call ahead of your appointment time to give you specific instructions as to how to prepare and what steps to take for your appointment. A reminder of the next opportunity for our blood drive is Thursday, May 14th. The Bloodmobile will be parked in the MGH 330 building parking lot. And if you would like to schedule a donation time, please go to givebloodnow.com and schedule a donation appointment for that blood drive. We also want to continue to thank you for observing the importance of maintaining social distancing while in public areas and wearing a face covering. As we have seen, these are important measures to continue to put into practice. Thank you.
Thank you, Sarah. And next we will be joined by Dr. Brad Lindsay of Marion Community Schools.
Thank you, Angela. I sure do appreciate you, Angela Stepp and Sunday Crest Baptist for this, for your mission and this opportunity for us to share each week. Thank you so much. And thank you, community. We sure do love you. And you guys are rising to the occasion, uniting together, and making best possible happen for each other. Thank you so much. In terms of schools, once again, still please stay connected. Relationships are so important. So reach out to teachers and social workers and principals, and we're going to do the same. Thank you for doing so. Please continue to check daily the school websites, because we update that with essential information. That's our best way for us to get the information out, so please check school websites daily. The governor, being proactive along with the Indiana Department of Education, have canceled school-sponsored activities in buildings or on campus through the month of June. And so we'll be looking forward to the next couple weeks for beyond June. For us at Marion Community Schools, we have virtual kindergarten roundup on May 14th at 2 p.m., but we can't wait for our new kindergartners and for this upcoming school year. Our teachers and our principals and our social workers, we can't wait. Virtual kindergarten roundup, May 14th, 2 p.m. Check our school websites. For Marion Community Schools, our last student day for this 2019-2020 school year is May 14th. That's our last instructional day. We are having a virtual kind of a video celebration for our Marion Giant class of 2020. That's on May 31. And then we have planned, if permitted, for homecoming weekend at the end of September to have a traditional commencement to celebrate our fantastic class of 2020 who are record holders for college credits earned and professional certifications. It was just been a phenomenal class. Our summer at-home learning will begin on Monday, June 1, and that will look like the best version of what you're experiencing now. More information will be forthcoming as we approach June. Food distribution is again tonight at Justice Intermediate School, 4 to 6. So far, the accurate number is over 275,000 meals served, an average about now 39,000 per week. Thank you guys for making that so successful, and so many people in the community rallying, supporting, and sponsoring. We just thank you so much. Thank you, community, for loving and caring for one another, being kind and considerate, uniting together for this fight to make best possible happen for each other. We live live in a great community. Thank you.
Thank you, Dr. Brad Lindsay of Marion Community Schools. And next, I would like to invite Aaron Grindstaff from TLC Management to share an update with us.
Thank you. Good afternoon. I'm honored once again to be here today to speak on behalf of Colonial Oaks Health and Rehab and TLC Management to provide an update on Colonial's situation. First, I just want to make sure I thank the many community members, family members of residents, and businesses that have been donating food, snacks, and providing words of encouragement to our staff throughout this. I just ask that you continue to please keep that up. It's much appreciated. Although this has been an unprecedented challenge, I can say this is not a challenge that Colonial Oaks was prepared to back down from. The COVID-19 virus is unforgiving and it does not discriminate. Unfortunately, over the last 3 weeks, we have confirmed a total of 46 resident and 33 staff positive cases in the facility. We decided to take an aggressive approach to testing, felt that was the best approach to isolate the virus, and we found by testing both symptomatic and asymptomatic individuals, we were able to really understand the true numbers of what's in the community and what's in our community there at Colonial Oaks. We will never forget the 9 residents, our family, that we have lost to this virus. They will forever be in our hearts, in our thoughts, and our minds, and they're a constant reminder now of the sacrifices that were made in fighting this virus. We pray that we do not have any further loss, and I know we work tirelessly each day to try to prevent this. After every storm, there is a sunshine, and after every darkness, there is light. Today, I'm here to offer some hope and to share some of our sunshine with you. We're happy to report today that we have begun testing on our residents and our staff that have been at least 14 days from their initial diagnosis and are now asymptomatic. Although not all tests are completed, we have had 5 residents now test negative that were previously positive, and with one of these residents now receiving their second negative test. We've had 11 total staff members now test negative and are also happy to report that one of them has also received their second negative test. We will be celebrating this employee as she returns to work today. And we will also be celebrating today as our resident moves from the isolation unit back to her room with the rest of her Colonial family. As I've said before, in front of all of you, we will beat this virus. One by one, we're going to see it through. As I stand here today, it's National Nurse Appreciation Day. I can't think of a better way to appreciate our nurses and our staff at Colonial than by publicly thanking them for their service, their dedication, their commitment to serving others and the members of this community that makes it great. I'd like to introduce one of those nurses to you today who is a true hero and has been working day after day on our COVID unit, caring for each of these residents that we speak of. She has watched each of these residents fight this virus and has been by their side with many other staff, not just as their caregiver, but as their friend and as their family. I'd like to introduce to you today Brandi McClain.
Good afternoon. I would like to thank everyone for the opportunity to speak today, especially with it being Nurses Week. My name is Brandi McClain. I'm a 2006 graduate of Marion Community School of Practical Nursing. I have always felt a calling on my life to be a nurse, and when I received information that Colonial Oaks was making preparations in the event that there would be positive cases, I absolutely felt in my heart that I was called to be on the COVID unit. I've been there since day one, And I would just like to give some insight into what we are doing on that unit. We are doing our regular nursing assessments and our job, but we are also filling in that gap of the families that these residents are isolated from. I absolutely love every patient. My coworkers, we just greatly take pride in the care that we're giving them. There have been sad times, but we have also been able to laugh and just share in just everyday things, helping them find their favorite TV show, getting them their crossword books, praying with them, reading the Bible to them, and just genuinely caring for them every day. I want everyone to know that, yes, they are in isolation for the virus, but they are not just in a room alone. They are very much busy with activities which comes to our unit, and they are having a very fulfilling life, even in isolation. I would like to say that Dr. Shrikant and our nurse practitioner, Riley, who have been there every day, have been such a pleasure to work with. The residents really perk up when they see them come and do their rounds. We always see lots of thumbs up and smiles and waves. We have a couple ladies in particular that love to blow kisses to let them know they are feeling good. Yes, they have a positive diagnosis, but they are asymptomatic, and they are just part of these isolation precautions right now. I would also like to thank my wonderful coworkers, nurses, CNAs, QMAs, dietary, housekeeping and laundry, activities, social services, maintenance, central supply, and MDS. They have been there supporting us from day one. I know they have gotten many calls from our walkie-talkie system we have, and they always come through delivering the supplies that we need. And I would just like, again, to thank everyone for the opportunity to speak today.
Thank you, Brandi. We do salute you for your work and your efforts, and all of the nursing staff and staff there at Colonial Oaks. And next we will hear from Dr. David Moore from the Grant County Health Department. Welcome.
Thank you very much. It's my pleasure to be here with you again, representing the Grant County Health Department. We are now almost 2 months into this intensive follow-up of what we've been doing with a once-in-a-lifetime, maybe a once-in-a-century kind of infection that we're facing, an attack that we're facing as we go through this. And we have come together as a nation, as a state, as a community, and met it. We've done some things that have brought these numbers down from being something that was sweeping through the country, the things that are still attacking, but now beginning to look more manageable. And now we're looking to a point, how do we open up? How do we get back to something that is more normal? It's a new normal that we're going to be facing, but something that looks like a new normal. How do we gradually and how do we safely work through that? The governor has laid out a plan, a recommendation for the state that I have reviewed, and it seems bold and courageous, but it seems also thoughtful and monitored. So as we take these steps to see what we can do. Marion, Grant County, Indiana, we paid a price to get here. Let's don't squander it. Let's don't waste it. Let's take our time and take the steps that it takes to be there as we get back into normal life. Our mayor said he's waiting to get a haircut, and that's not an issue for me, but there are other things that I am looking to get back into. And I take the approach that while it is not perfect, that testing is the key to this as we begin to move forward. I see 3 layers of testing as it applies to our community. And the first layer is what happens at the hospital when you're sick and you present there and you've got illnesses and they need to know, is this COVID or is it not COVID? These are those who are at the door. Those are the ones that, if they meet the criteria, are going to be tested. We then move to a second layer of testing that we're beginning to see, and this is one where those who are are at risk in the community. This is our first line nurses, our first responders, our emergency workers who are there, those who are working in close confinement, that those are the ones that testing has been done and continues to be done, and I'll talk about that a little bit more there. But we want to know what their status is and what we need to do to take care of them and what we need to do to take care of their family. And when we initially started this, there appeared to be a great nationwide shortage of testing supplies. So testing people on the street who were curious or for whatever went on, when it would take away from those first line, those first and those second line people, would not appropriate to do. It appears that that shortage is now being addressed and dealt with, and so we may be moving into that third layer of testing that I'll talk to you more about in just a minute. I've been here in this town for now 25 years. I started working in the obstetrical units, and there the nurses determine our lives. They take care of our patients. They help to make sure the patients get through. And I'll tell a secret that if I'm not nice to my nurses, I get a 2 a.m. wake-up call to say, Dr. Moore, I just wanted to let you know everything was okay. So now that I'm not doing OB, I can tell that anymore. But the nurses really make a big difference. They have been there for us just like before. They're on the front lines taking care of you. And I cannot say enough to say how much we appreciate them. Testing, gradual steps. The first step are those in the hospital. The next step are those in the community, and our governor has said he wanted us to do more extensive testing. We now have testing for antibodies. We don't know exactly what that means. We know that you've been exposed, but does that mean that you're protected from getting future infections? Do those who have antibodies, can that blood be used to treat other people? Can it safely be used to do that? Can we use that as a basis for developing some sort of treatment or maybe a prevention with antibodies? We're going to know that. The state was here a couple of weeks ago and did that sample testing in Marion, Grant County, and they're doing it all over the state. And like the governor said, if it comes to you, participate in that, because that's going to help us to understand that is there. So that is now then the second line of testing. And as part of that, the state will be starting a program here next week. We anticipate it'll be on May 13th, that they'll be coming and setting up clinics running. And these are still for indicated persons, those who are symptomatic, that they believe that they're symptomatic, and they pass the screening for that, those who've been in close intimate contact with those who are positive, those who work on the front line, our first responders are in that category, and those who work in group homes. An example is Care Services, or maybe even our long-term care facilities at the great example that we've seen done at Colonial Oaks. This is going to be testing for that. It is by appointment only, must meet the criteria. The state is still, we've talked about this before, this is a battle that's ongoing and may well change as we go ahead. So at the end of this week, we're hoping to have on the Grant County website directions for how to go there and to see if you can get an appointment to be tested. They're going to do about 135 a week, and they're going to be 5 days a week. And if the situation changes on the ground and we need to do that differently, then we'll do that differently. For Grant County and for Marion, Indiana, the YMCA has been very gracious in making themselves available to us. They have a beautiful building that's there to serve the community that has been shut down. But there's a wing of that has its own air conditioning system, its own entry, its own exit, that the YMCA, after we made sure that it does not endanger in any way the other public that's in the rest of that building, the YMCA has made that available, and that will be the testing site that we have. And again, I appreciate the Y doing that, but that was done after we and after the Y made sure that that was safe. And so then we go to that third level of testing. You've heard the word, if you want a test, you can get a test. Well, that isn't practically available in Grant County and maybe in places not in Indiana, but it's something that we're looking to see, can we do that? that your elderly grandmother in Ohio that you haven't seen for months because of this, you want to go visit her, and you want to know, am I safe? Am I going to take anything to there? Can those kind of people be tested? You don't meet that high criteria that the others have, but can those people be tested? We now have the testing supplies available for those people, and we're looking to see, is there a way that we can safely make that happen? That's not right now, but it's something that we'd like to see. We'd like to take the example from Colonial Oaks. When it was appropriate, they were following the standard way, had issues. They said, let's test everybody. And once they tested everybody, they found that many of the infections were coming from people who were asymptomatic in the community. And as we begin to rein this in and begin to try to get this under control for now, we also now need to look to see where else in the community is this infection. How can we do it? Colonial Oaks shared with me something that they did. They now have 3 wings. They have a red wing, a green wing, and a yellow wing. Those who the staff and the residents are known to be negative, those who are known to be positive, those who are under investigation. They could only do that once they begin to test and test and test. And that's where I'm recommending that we as a community look to see, can we go? Can we have those who have a question in their mind? Some of them are going to be reasons like, I don't want to take something home to grandma. Others are going to be that I want to know, is this cough something that I need to be following up on my doctor about? Or some people are just at home terrified, is this Colonial, and am I going to give it to my kids when I see them again? That we're looking to see, can we make that available? And as a community, can we do this? It's been a long battle. We've come together. We fought this well. We're going to get there. We're going to get home together again. Be kind to one another. Keep us all in your prayers. Thank you. Thank you.
Thank you, Dr. Moore. And as we conclude, I would like to also let you know that Eastbrook Community Schools Corporation, they are doing food distribution every Monday from 3 to 6 p.m. at all Eastbrook schools. And also, Second Harvest Food Bank has partnered with Eastbrook Community Schools for food distribution, and that will take place at both elementary buildings on the dates of May the 20th from 4 to 5 p.m. and again on May the 27th from 4 to 5 p.m. And so there you have Eastbrook Community Schools, their Mondays, 3 to 6 p.m. every Monday, food distribution at all buildings within the Eastbrook School Corporation. And again, then Second Harvest will be offering food distribution on May the 20th and May the 27th from 4 to 5 p.m. at both of the Eastbrook elementary schools. As we conclude today's update, I would like to say thank you to our local media for their coverage, especially to WBAT, the Chronicle Tribune, and the News Herald. And I would also like to let you know that today's broadcast will be re-aired here on WSOT TV at 5:30 p.m. today and again at 10:30 p.m. Additionally, on Sunday at 10 a.m. and at 5:30 p.m. And this concludes today's update. Stay tuned for some more programming here on WSOT TV.